Why is it so important to treat ear infections? Audiologist Dr. Gnewikow has the answers.
About 50% of all children have an infection in the first year, so it's fairly common. Most of the time it's not a big deal, but sometimes it can be. Sometimes we don't realize it until we see the child pulling at their ear, or maybe they have a little fever or something. So just to give you some idea as to why kids get ear infections, this is an anatomy chart, kind of a cutaway of your ear. Of course, sounds come into the outer ear and they hit the eardrum and it begins to vibrate. Well, behind the eardrum is an open space we call the middle ear. And across the middle ear is a little bridge of bones. Your high school PE class, you probably remember the hammer, the anvil, and the stirrup. These bones actually carry the vibration from the eardrum across the open space of the middle ear to the inner ear, where they're changed into electrical pulses. So the inner ear, of course, would be a microphone. At the bottom of the middle ear is a tube. It's called the eustachian tube, and it's an air equalization valve. So every time you swallow, it opens momentarily, and the air pressure from the inside of your head around the back of your nose rushes in, so that the air pressure behind the eardrum is equal to the air pressure in front of the eardrum, which means the eardrum is in a perpendicular position, and it vibrates very efficiently. In little children, it's not always at this angle. In younger children, the eustachian tube is more on a horizontal plane. And so as a result of getting clogged up head and getting mucus up in their nose and things like that, sometimes it can kind of work its way up in here and it can get infected to the point where the valve gets plugged up. So then when the child swallows, it doesn't open. When it doesn't open, little by little, the air that was in here begins to disappear. And so this eventually becomes a vacuum. Well, vacuums always want to be filled. So if you've got high air pressure out here and a vacuum behind the eardrum, then it's going to push the eardrum into the middle ear. It also causes the vacuum effect for all the tissue that's lining the middle ear, which is wet, kind of like the inside of your mouth. And little by little, the room begins to fill up with fluid. And so when the fluid gets high enough in here, or it gets viscous enough, the eardrum no longer will vibrate. And as a result of that, sounds have to be much louder to get it to vibrate the way it did when it was normal. So that can be an issue in young children. When it happens, of course, medications are generally the first line of defense. But sometimes if medications don't help and it continues to occur over and over, you probably need to see an ENT doctor, an otolaryngologist, and sometimes they'll put little air ventilation tubes in. And what they do is they put a little pipe, a little tube through the eardrum, and it actually makes a new eustachian tube. So now, even if this one is not opening and closing to equalize the air pressure, it comes through the tube and equalizes it. And that's basically what causes an ear infection in a child.
And let's talk some signs and symptoms with my own boy. He had 3 sets of ear tubes. We had a lot of hard time with ear infections, partly because he would have no signs or symptoms. He wouldn't get a fever, he wouldn't pull on his ears. But besides that, are there any other signs?
Well, I think the most obvious sign is hearing a lot of hums. Of course, you may hear hums when he hears perfectly normally, but look for indications of reduced hearing. Television's a little bit louder. You're telling him to do things and he doesn't do them, and you know that it's not his personality, that it really is the fact that he may not have understood you. But typically very, very young children, babies and infants, children 2, 3 years old, a lot of times they may tug on the ear, or there may be a little fever involved with it.
And we actually have a very cute volunteer today to show us how it's done.
Good, and we'll go take a look at that. Okay, this is a nice little patient who's going to do exactly what we tell her. So you see the little tubes in the ears, and that's where the sound is going to come through. And every time she hears a sound, she's going to put a block in the bucket, and that tells us that she heard the sound. And so, we're going to test her now. And the audiologist would be out in this room here. And of course, she's running the equipment, and she's putting sounds in the child's ear at different frequencies and different volume levels. And every time she hears it, the child will respond. And when she responds, this is what's called play audiometry. She would simply drop the block into the bucket. We do that with what's called air conduction testing. And now I'm going to show you the second test we do. This is an oscillator. So this actually vibrates at different frequencies, and it allows sound to go to the inner ear, but it skips the eardrum. It goes directly through the bones of the skull. So we're going to put this on her now. And she does the test in exactly the same way. She hears a little sound, and when she hears the sound through the vibrator, then she responds, and we can tell if the inner ear is working normally. And we can compare how she hears through the vibrator compared to the earphone. And if there's a difference, then we know there's probably fluid in the ear. One of the tests that's probably the most important that we do for children who have ear infections is called tympanometry. So this little probe here is stuck into the ear canal, and we actually pump air pressure into the ear canal, and then we pump air pressure out of the ear canal, and we watch the eardrum move through this piece of equipment. And if the eardrum is moving normally, then we know there's no fluid in the ear. But if the eardrum is not moving as we change the air pressure, then we know more than likely the eustachian tube is not working and fluid has been built up in the ear. And again, if that persists, then the child needs to see an ENT physician, and they can generally solve that problem.
And what happens if these ear infections aren't treated?
Well, if the child's hearing is down, we've kind of touched on that before, it can affect speech and language development if it goes on for long periods of time. But more importantly, sometimes you can get infections that can cause other medical issues. You can have perforations in the eardrum. You can eventually have infections in the mastoid. So sometimes they can be fairly serious issues. That's why it's important, if you have persistent ear infections, that you let it be dealt with by a local ear, nose, and throat physician. Fortunately, over the years, ear infections have been on the decline. One reason is there are more moms breastfeeding now. Breastfeeding moms tend to have less ear infections in their children. Antibiotics are a lot better now than they used to be, so that's been very helpful. And also there are less people smoking. If a child is being raised in an environment where the parents or the grandparents are smoking, there is a greater incidence of ear infections in those. So don't take ear infections lightly. They can really affect the kid, and in the long term, there can be some results that may affect them the rest of their life.
And to learn more about ear infections and hearing loss, you can call Audiology Hearing Aid Associates, one in Lynchburg, 434-528-4245. Also in Danville, 434-799-6288, and online at digitalhearingforyou.com.